Hello, thank you for joining me. I'm Dr. Tracy Paschke. I'm a preventive cardiologist, and today I'm going to talk about how to prevent a heart attack, strategies for a healthier heart. So my company is Heart Health Prevention and Wellness, and I'm a board certified cardiologist certified in internal medicine and cardiology. I practice preventive cardiology. So I've been a cardiologist for about 25 years, and I spent most of my career taking care of people when they had heart attacks and congestive heart failure and abnormal heart rhythms. And then I decided to focus more on preventive cardiology. So helping people prevent them, helping keep them from having a heart attack or heart failure in the first place. So not just treat them after they get it, but help them prevent it in the first place. So here are some pretty sobering statistics. Heart disease is the #1 killer of men and women. And a lot of women don't realize that, but cardiovascular disease kills more women than cancer, diabetes, Alzheimer's, accidents, and chronic respiratory disease combined. Cardiovascular disease accounts for almost 1 million deaths per year. And in the United States, someone has a heart attack every 40 seconds. So with those sobering statistics, we need some good news. So the good news is that the American Heart Association estimates that 80 to 90% of cardiovascular deaths are preventable with lifestyle modification and treatment of risk factors. So what causes a heart attack? What is a heart attack? So a heart attack occurs, this is your coronary artery, so one of the arteries that lies on the surface of your heart. And you have some plaque in the artery, that's the yellow stuff. And this plaque doesn't even have to be a severe plaque. In fact, most heart attacks occur in the setting of mild cholesterol plaque. So you have this mild cholesterol plaque that then suddenly becomes inflamed and unstable. And, and that's where inflammation plays a role in heart disease. So inflammation is thought to be what causes the plaque to stick to the artery in the first place, and then what causes the plaque to become unstable and rupture. So the plaque ruptures and it releases all these things into the bloodstream that cause the blood to start clotting. And if the blood clots and the clot becomes big enough, it blocks off this whole artery, and then you don't get blood flow down to this part of the artery. So then let's say that plaque that we just saw was right here, where I drew that little blue glob. So the blood clot, this is the artery that runs down the heart, and you develop a blood clot in there after the plaque ruptures. Then this part of the heart, the muscle that's supplied by that vessel, doesn't get good blood flow. And if it occludes blood flow long enough, it can damage the heart tissue here. So that's what a heart attack is, damaging the heart muscle from that blockage in the artery. So what are symptoms of a heart attack? Chest pressure. So it's not typically chest pain, but more pressure. So pressure or tightness usually in the center of the chest. The classic description is an elephant sitting on my chest. So pressure in the chest. Sometimes the discomfort can radiate into the left arm and cause left arm discomfort. You can feel shortness of breath with it. Sometimes people get sweaty, break out in a cold sweat, feel nauseated or have dizziness, extreme fatigue, and then sometimes people get more GI symptoms. Women tend to have more GI type symptoms, so indigestion or abdominal pain. So now we've talked about what a heart attack is, and we have some great treatments. If you have a heart attack, they can go in and open that blocked artery and restore blood flow, and people tend to do very well. But again, we want to avoid heart attacks if we can. And so we need to look at the risk factors for heart disease. So what are the risk factors? So we have some non-modifiable risk factors, we call them. So, your age, your gender, your family history, race, and ethnicity. These are the things that we can't control, right? Things that are out of our realm of modifiability. But then there's a whole bigger list of modifiable risk factors. So things like smoking, high blood pressure, high cholesterol, diabetes, obesity, unhealthy diet, physical activity. So these are risk factors for heart disease, and these are the things we can control. So again, remember the statistic I gave you that it's thought that 80 to 90% of heart disease is preventable. That's because it's the modifiable risk factors. So these are the things we can control. So how do we control those things? How do we prevent a heart attack from occurring in the first place? So a big one is diet. So in the United States, most people eat the standard American diet or the SAD diet. So the standard American diet is full of meat, animals, and animal products. So meat, milk, cheese, eggs, and it's full of saturated fats. And all of those type of foods are inflammatory. They sort of rev up the inflammatory system in the body. Those animals and animal products contain cholesterol. So we know that people who follow more of a plant-based diet do better. They have less heart disease, less cancer, less autoimmune diseases, less gut problems. So the diets that have been shown to help prevent from a heart standpoint, the type of diets that are recommended are a whole food plant-based diet, the DASH diet, you may have heard of that. So that's the lower sodium, higher potassium type diet. Again, rich in fruits and vegetables, whole grains. And then the Mediterranean type diet, you may have heard of that. So that's more, again, more of the way that Mediterranean people ate in the past. So more plant based, so fruits and vegetables, fresh fruits and vegetables, usually a little bit of meat in their diet. But again, it's kind of the side thing. It's not the main part of their plate like it is for most Americans. So you want any of these diets that I mentioned that are good for your heart are also good. They prevent cancer. They prevent those autoimmune diseases. They are good for brain health. So you don't have to follow a certain diet for your heart and a certain diet for your brain and a certain diet to prevent cancer. If you follow a good, healthy diet based in a plant-based diet, you're going to cover all those bases. So you want lots of fruits and vegetables. You want whole grains, beans, legumes, nuts, seeds, and try to keep your oil to a minimum because oils are inflammatory. But if you are going to use oil, choose olive oil. That's probably the best for your heart. So then next is exercise. So the American Heart Association recommends 150 minutes of moderate intensity aerobic exercise a week. So that's a nice brisk walk. 30 minutes, 5 times a week would get you there. So however you want to break it up, some people like to do 10 or 15 minutes several times a day. But however you get your 150 minutes, that's the important thing. And then, of course, we need a couple of days of strength or resistance type exercises for our bones and muscles. Restorative sleep is a very important part of heart health. We know that sleep disordered breathing is related to elevated blood pressure, difficult to control blood pressure. It's related to abnormal heart rhythms. Sleep apnea is related to congestive heart failure, stroke, and even sudden death. So it's important to make sure not only that you're getting good sleep, 7 to 9 hours of sleep, but you know, you want to make sure it's good restful sleep. So not only that you're asleep, but it's good deep sleep and you're not having apneic episodes. And sometimes that requires some testing to sort that out. Stress management is an important part of heart health. We know that stress increases the stress hormones. So in the short term, stress hormones are good, right? So back in the day when we ran into a tiger, we would get a surge of our stress hormones, and that would prepare our body to take off, right? To run away from the tiger or fight the tiger. That's called fight or flight. And so in the short term, that's good. But what's happened is in our modern society, we're under a lot of stress all the time. We're bombarded with news and social media about bad things happening not only right around us, but on the other side of the world. And we have financial worries and climate worries and work and family stresses. So all these things put a lot of us under this state of chronic stress. And so this chronic stress increases our stress hormones, on a consistent basis, and that's not good for our health. So we need to work on ways to reduce our stress, things like yoga, meditation, walking in nature reduces stress, journaling, connecting with friends and loved ones helps reduce our stress. And then even things like grounding, where you touch the earth with your bare feet, decreases inflammation. Things like tapping, where you follow the meridians, some meridians. It's related to ancient Chinese medicine, so some people find that helpful. So there are a lot of different things, and we can find YouTube videos or apps to teach us about different things that we may not have tried that might help with stress management. So I encourage people to always try different things, see what works best for you. So next, we want to avoid risky substances. So, hopefully everybody knows by now that smoking cigarettes is bad for us. So everyone needs to stop smoking. It's not easy, obviously, or nobody'd smoke, but there are ways to help you quit. There are some, nicotine gum or patches that you can buy over the counter. You can get prescription medications from your physician to help you stop. There are things people try like hypnosis and acupuncture, support group. So again, whatever works for you, I tell people keep trying. So even if you've tried to quit smoking and you weren't able to quit, try again. Maybe this time will be the time you're successful. And then when you quit smoking, you have to be careful to avoid things that might get you back into the habit, right? Some people say, oh, I'm going to have a beer tonight. I'll just have one cigarette. Well, often then that turns into a pack and then you're back smoking again. So try to disconnect any habits. So a lot of people, they'll have a cup of coffee in the morning and smoke their cigarette in a certain chair. So I tell them to, you know, just change up the association, right? So instead of having your coffee in that chair, maybe you sit in a different chair and you have tea instead, or something that sort of tells your brain to break that other bad habit and substitute a good habit. Alcohol, we used to tell people that a glass or two of red wine was okay, or actually good for the heart. We're not really suggesting that anymore. Most cardiologists are not. They reviewed that data on red wine a year or so ago, and the data is a little sketchy. So plus, you have all the other problems that come with alcohol, because sometimes people hear you can have a glass or two, and then next thing you know, it's three or four, and then it's a bottle a night. So plus you have other, the alcohol is a toxin to the heart. So people who drink a lot of alcohol can get what we call an alcoholic cardiomyopathy, so where they get a weak heart muscle from the alcohol. And then, of course, alcohol causes a lot of other problems with brain health and memory issues and falls. And so, I think it's just best to tell people to avoid alcohol, cut it out. The other thing, alcohol is inflammatory. So again, if we're trying to decrease the inflammation in the body, we want to cut out alcohol. And then the last one I want to talk about is marijuana. So, marijuana has become legal in a lot of places, so more people are using marijuana. There hasn't been a lot of data on marijuana in the heart, but it's starting to come out now. And so far, most of the data is not good for effects on the heart. So, increased risk of elevated blood pressure, arrhythmias, increased risk of stroke and heart attack in a recent study. So I'm telling people to avoid marijuana until it gets sorted out a little bit better. And then lastly, regular health screenings, right? Because if you don't know that you have some of these things, like diabetes and high blood pressure and high cholesterol, then you can't modify those things, right? So I tell people, you want to know your numbers, right? Just like we know our height and our weight, you want to know your blood pressure and your cholesterol, and you want to make sure these things are well controlled. These days, you can buy a blood pressure cuff online or at Walmart or Target, the pharmacy. Get an upper arm blood pressure cuff, and you put your feet up flat on the ground and relax. Sit there for a couple minutes. Don't have to go to the bathroom because that can elevate your blood pressure. So you want to be relaxed, not talking, feet flat on the floor, arm level, like on a desk. And then you pull up your sleeve, have your bare arm, and you put the cuff around your upper arm, and you blow it up and check your blood pressure and write down that number, or sometimes it saves it on the monitor. And then you let it down and wait a minute or two and blow it back up again, and you'll get another reading. And then you can just sort of average those readings. So blood pressure is fluctuating all the time. It goes up and down with different physiologic things going on, and goes up with stress and infection, and so different things change it, but we want to get an average reading, right? So over time, um, we want to know what our blood pressure runs at different times of the day, what our normal reading is. And it should be 120/80 or less. So that's your goal for everybody. So you need to know your numbers. So people say, well, I go to the doctor once a year and they check my blood pressure and it's fine. Well, that's just one day out of 365 days, right? So again, you want to know your numbers. And everyone should know their cholesterol numbers. In my clinic, this is what I do for I call it the heart health prevention and wellness roadmap. So we take a look at all this stuff, right? So we do an extensive intake and review. So we review your medical history. You fill out some forms, a little more in depth than most people are used to at their doctor's office. So we talk about your sleep habits, your stress, your family history. And then I have you complete a 3-day food journal because I want to know, what's going on in your normal day, in your normal life. And then we talk about advanced lab testing. So most people know about a standard cholesterol panel, but there's more to it than that, right? So a standard lipid panel includes total cholesterol, HDL, LDL, and triglycerides. But we know that there are other lipoproteins that also affect cardiovascular risk. So you may have heard of some of these. They're kind of newish, but one is LP little a and one is ApoB. And we know that those particles are more atherogenic, meaning they cause more plaque. LP little a is one that's mostly genetically determined. It explains why some people have a very strong family of heart disease. Often we find that LP little a is elevated. So again, once we know that, we can tailor your preventive strategies directly to that. We also I'm also checking in my practice inflammatory markers because we know that things like CRP, for example, that's a marker of inflammation in the body. We know that people with elevated CRP are at increased risk for heart attack. So again, we can tailor treatment specifically to that. And then in my practice, we do some sort of advanced cardiac diagnostics. So cardiovascular disease, even though it's the #1 killer of men and women in the United States and in the world, in fact, but there is no standard preventive screening that is recommended by guidelines other than the standard lipid panel, and that's paid for by health insurance. So you know how we have mammograms to screen for breast cancer, and we have colorectal screening to check for colon cancer. Well, there is no recommended test to look for plaque. So we look at cholesterol and assume, if your cholesterol's high, that puts you at increased risk. But don't forget that most people who have heart attacks have normal cholesterol levels. So that means there's this huge thing we're missing, right? And so today with technology, we have ways to actually look for plaque. So there are different ways we can do this. There's carotid intimal thickness test. So that's an easy ultrasound of the carotid arteries in the neck. And we know that plaque, thickness of the carotid artery and plaque in the carotid artery correlate with plaque in the heart artery. So it's a sort of a surrogate marker for that. So that's a good, easy screening test. We also have a test called a CT calcium score, and you may have heard of that. That's a test where they measure the calcium in your arteries. So that test looks for calcified plaque, which is hard plaque. So one of the downsides of that test is it doesn't look for soft plaque, so what we call soft plaque or juvenile plaque. So that's plaque that's more likely to rupture actually is the soft plaque. So we miss that with a CT calcium score. But one way we can see that type of plaque is with a coronary CTA. And then there are other things that we can add to the coronary CTA. One is called Clearly, where it gives us a picture of the plaque and it tells us what percentage of where the plaque is and what percent blockage you have with it. And then it tells us what type of plaque is it. Is it the hard calcified plaque that's more stable, or is it the more unstable type of plaque? And again, once we know specifically what you have, then we can tailor your preventive strategies or your treatment strategies to you specifically. So then the other thing that I work on in my clinic is mindset for success, right? So sometimes people, especially like people who have a lot of cardiac risk factors, or maybe they have a very strong family history of heart disease, everybody in their families died of heart attacks, and people, they're scared and nervous that they're going to have a heart attack or a stroke. I try to help people sort of change their mindset about to feel more empowered, right? So that's the great part about preventive cardiology, is that we work to prevent the heart attacks and strokes instead of just treating them after the fact. So, and the fact that 80 to 90% of cardiovascular disease is thought to be preventable, well, that should help you feel better about it, right? Have a better mindset, feel more empowered that you can actually make some changes that would be helpful. So then again, in my practice, we review diet and inflammation, things that might be adding to your inflammation, which again is thought to play a role in what causes plaque to stick to your arteries and what causes plaque to become inflamed and rupture, which is again what causes heart attacks. So then we discuss stress management techniques. We check you for sleep apnea, evaluate your oxygen during sleep. We talk about new ways to move. So maybe incorporating some movement that you might not think of as exercise, but again, it helps you be more active, shoveling the snow or sweeping the floor or sweeping the driveway. Gardening is a great way to move. So things that keep you active as opposed to sitting on the couch and looking at our smartphone. You go for a walk or you dust the living room, just something to move more. And then with the goal of all this is not only do we prevent strokes and heart attacks, but we live a long life in good health, right? So we increase our health span. So we want to increase our lifespan. We want to live to be 100, say, but we want to live that in good health. So we want to increase our health span as well. So all of these things that we're doing to affect our heart health also affect our health span, which is the ultimate goal. So in my practice, I offer a free health consultation. You can scan the QR code and I do an initial consultation, and then we go over things and see how you fit into that roadmap and what other services you need. So feel free to scan the QR code, it takes you directly to my scheduling calendar, and then we'll get you on the schedule and we'll talk about your personal health situation.